from the News Channel 5 network. This is Titans Tuesday.
And a good Tuesday evening, everybody. I'm Hope Hines. Welcome in. We've got Titans Tuesday on this Tuesday night. Of course, this is after they lost. It would be, right? After they lost to the New York Jets on Sunday afternoon, 34-13 at LP Field for their first loss of the season. I don't know. Yes, I do. I guess most people are surprised that they lost. Now, I don't know many people that didn't think they were going to lose to somebody somewhere down the line. What we are surprised at, though, is how they lost and how badly they looked in losing on Sunday. I mean, they had no answer for the Jets. I mean, the Jets were all over them from beginning to end. It was 3 and out for the Titans when they kicked off, and then Brett Favre, who is just a tremendous quarterback, as we all know, came right back on their first possession, drove it down the field, scored. And that pretty much was a ball game, except they had to go ahead and play the entire 60 minutes. All right, so this Thanksgiving Day, they are in Detroit. Now, this time, things ought to be a little better as they go to Detroit for a Thursday Thanksgiving Day football game. That team has yet to win a game this year, so everybody's saying, hey, piece of cake, right? No, that's not right. In the National Football League, you see Detroit's going to beat somebody before the year's over, and it's going to be somebody that somebody didn't think they could lose to. So be careful. And, of course, the Titans know that. On the show tonight, we have Dr. Brandon Downs. He's an orthopedic surgeon, and he is with Premier Orthopedics. And, of course, he's being brought to you tonight by Baptist Sports Medicine. Let's say hello to the good doctor. Doctor, good to have you here.
Thank you very much.
And we understand that you are, well, we know that you're being brought to us tonight by Baptist Sports Medicine. But as you said a moment ago, or as we said, you are a local product.
That's right.
From MBA.
Yep.
Grew up here and went to college in Memphis.
College at Belmont.
I'm sorry. Well, that's right. Belmont College, and then to Memphis.
Memphis was my residency at Campbell Clinic.
All right. Very good. We're happy to have you here tonight. You are part of Baptist Sports Medicine's part of the program tonight. Your specialty, of course, is sports medicine. Now, when we say sports medicine, what are we talking about?
Primarily talking about shoulders, knees, some elbow work. A lot of it is injured athletes, young people, you know, something different primarily than fracture care and joint replacement primarily, but a lot of rotator cuff injuries, ACL injuries, meniscus tears, that sort of thing.
In your line of surgery, do you find that there's a difference in orthopedics with younger people as opposed to older people?
There certainly is a difference as far as what you commonly see. Younger people more often would be an acute injury, something that happened suddenly after, you know, some untoward event. Typically, if you get a little older population, you're talking about arthritic conditions, a little more fracture prevalence with lesser injuries.
What can one do as you get up in years and in age to protect yourself from bone damage or bone erosion, shall we say, or is there anything you can do, or is it hereditary?
Well, you certainly can do many things. You can stay active, and that helps you as far as your muscle tone, staying fit. It will also help your bone health.
So I'm just going to interrupt if you don't mind. So one of the worst things that people can do over 50 or 60 or even 70 or 80 is just to sit.
Sure.
Don't just sit.
Absolutely.
In other words, you don't want to go work out with the guys that are 25 years old and pump iron, but you can walk.
Absolutely.
You can get some dumbbells and do a few things, you know, and just do a minimum amount of exercise. Just don't sit. Absolutely.
Yeah. Staying fit is a very key thing for people at all stages of life.
Okay.
Also, you want to have proper nutrition. That does a lot as far as your bone health. As people age, particularly women, as they reach menopausal age, you can lose a tremendous amount of bone quality quickly. So proper nutrition, proper medical care for that time period is very important.
Okay. So, and you run pretty much the gamut in your practice, I know, from what, you know, what's I guess the youngest child that you treated?
Well, we do everything from, you know, young children, particularly in our training, you know, clubfoot surgeries, scoliosis problems, all the way to very elderly people with hip fractures. So you see musculoskeletal problems throughout all life's ages.
What is, in your opinion, is one of the more exciting things in innovations in technology has your field encountered of late?
We can do a lot more with problems that used to be more difficult to treat. People that had cartilage issues in the past oftentimes didn't really have a very good option for what to do now. After they've potentially have a knee arthroscopy with removal of loose cartilage, oftentimes they're left with a defect that they couldn't manage any other way than just to work around it as best they could. There are reparative procedures, restorative procedures, and if those things don't work, even minimally invasive or small replacement procedures to try to get that person going again without going all the way towards a total replacement of that joint.
The big long scars that we used to see on the older athletes, especially football players and basketball players, you don't see that anymore. It's gone.
Yeah, they're getting diminished. Almost all of the young athletic care is done arthroscopically, and even total joint replacements are done through much smaller incisions, shortened recovery, less post-operative pain, and that's done a tremendous bit for their improvement.
You've heard the old adage, if you're a baseball pitcher, you only have so many pitches. That's correct. If you're a quarterback, you only have so many throws. Right. Is that right, or is that just an old wives' tale?
Well, I tell you, we've got a lot of older quarterbacks in the NFL right now.
We do,
so
don't we?
With a good athlete and good medical care and the benefit of avoiding serious injury, you can certainly play for a very long time.
Kerry Collins and Brett Favre are two prime examples, especially Brett Favre. And I mean, he still looks to me like Doc throwing the ball as well, or maybe better than he ever has.
Right.
39 years old. That's old as far as athletics is concerned.
Yeah, I was at that game, and he looked good.
Yes, he did. He did indeed. So, however he's put together, put together very well. And of course, they maintain a exercise and workout regime that keeps them in tip-top physical condition.
Absolutely.
No question about that. We all should be so motivated, right?
That's right.
And then you would be seeing a lot less people.
That's true.
And,
That's true.
And life would be good for the other people on the other side of the desk from you. I'm trying to think with the Titans right now. We don't have any real major injuries. You know, we've got, for instance, in the game, Albert Haynesworth got a concussion. I mean, he was knocked silly there for just a little while. That's not really your area, I know, but still, when that happens, it's kind of a scary thing. And you know, now the National Football League is really paying, and they have for the last 4 or 5 years, close attention to concussions. Right. Because you can only, you know, that's one of the reasons Frank Wycheck is no longer playing. He just was sustained too many. You get to the point where you say, whoa, I don't need any more. That's enough. Right. Right. You definitely want to make sure the athlete is fully recovered before they go back into the field to play. It's something we've learned a lot about, and you want him to be fully recovered before he gets back. The toughest kind of surgery you ever do is what? I mean, just from the most complicated. What is that? Yeah. Probably the most challenging would be a serious injury to the knee or the shoulder, possibly including a dislocation. Oftentimes you have multiple ligaments injured at the same time, possibly even including a fracture. Wow. And that's challenging to get that person back to, you know, particularly to a high-level athlete, to get them back to that previous level of function. Can you fix all of that in one time, one operation? Typically it's all a one-time operation, yes. You're trying to get all that down in one setting so that you can get them into the recovery phase. I had a doctor, an orthopedic surgeon, tell me one time, doctor, that, you know, we're all very good at what we do, and you're very good at what you do, and you've, you know, like an old quarterback, you've seen it all just about. But he told me, he says, you know, he says, I really don't know what we're going to get until I get inside. Right. And I guess that's true. Right. I mean, because I have a meniscus tear and a million other people have a meniscus tear, it's not necessarily the same, is it, from person to person? Right. Could be different. Oftentimes what makes a big difference is the status of the cartilage of your knee, which is kind of a different kind of padding in your knee besides the meniscus. And the MRI scan may not show that as well as we would like at times. So that can do a lot as far as the outcome you get after something like a meniscus tear. In athletics, especially in football, we hear players who are injured and they call it a high ankle sprain. Right. What are we talking about? Typically you're talking about an ankle sprain that goes up into the leg a little higher, separating the two bones of the lower leg in a violent fashion. It takes a lot longer to recover from an injury like that. It's more involved than just a low ankle sprain, which is primarily the ligaments where the foot and the ankle connect. So the recovery is more difficult. Sometimes you even need to do surgery to address that. So it can take a lot more time. And the knee would definitely be the most fragile part of one's body. As far as incidence of injury in athletic events, it's very high up there, absolutely.
a lot of injuries.
Because it takes a lot of wear and tear. It takes a lot of stopping, starting, cutting, moving, twisting, turning.
Right.
It's a one that just doesn't all tear apart, isn't it?
That's right.
But it does. I mean, they you know, some guys go the whole career and never have a knee problem. Some have 4 and 5 operations.
Absolutely.
On one knee, right? Absolutely. And then when it's over, they can't hardly walk.
That's right.
But I mean, there are many of them out there. So yeah, exactly. Well, Doctor, it's been a pleasure.
Thank you.
Thank you for being here, Dr. Brandon Downs. And I'm sure you have a lot of friends out in the community here. You went to high school here, and your family lives here, and so we appreciate you being here. And Dr. Downs is brought to us tonight by Baptist Sports Medicine. Thank you, sir.
Thank you very much.
Thank you. All right, we're going to take a break. We will come back and continue with Titans Tuesday right after this.
Titans Tuesday, brought to you by Baptist Sports Medicine.
It's time to put an end to living on the sideline. With joint replacement, the experts at St. Thomas Health Services can get armchair athletes into the game.
Honey, what are you doing? Please don't do this to me.
Life isn't a spectator sport, so jump back in. Visit sths.com.